We're joined today by Thai Dr. Ekaphum. You have been based in the UK since 1997 and practicing medicine in the UK.
Yep.
So you've become kind of a spokesperson for Thai people stranded abroad, specifically in the UK. I'm from the UK and you're from Thailand, and we're opposite sides of the world. But what's it been like practicing medicine during COVID-19 in the UK?
Yeah, well, in the UK, the COVID outbreak started back in January, isn't it? When we started having, some cases. At the time, generally everything was quite normal, but I think when the country went under lockdown in the last week of March, it became more challenging because there were more cases. Death rates started to go up, and as a GP or family doctor, we try not to bring patients in, to be seen in our GP practice or in the out-of-hour centre. This is to try to actually minimise the spread of the infection, from the healthcare professional to the patient, vice versa. Okay, so we dealt, with most of the health problem by telephone calls. Patient have opportunity to send pictures, of their rashes, of their skin problems, their redness in the eyes, their throat, to our email kind of system, which is confidential, and we can view it, and we can speak to them over the phone. We can diagnose the problem. We prescribe medication. They can go and pick up the medications from the chemist, because we can fax it or send it electronically to the chemist. Now, for the elderly or vulnerable individuals, so those with comorbidities, lots of health conditions, we try to encourage the family or friends to help. In terms of working as a doctor during this, during that time, I think we've gone past the peak now. But during the kind of pre-peak period up to the peak time, we had, protection gears to wear. So I didn't find that, I was short of them where I was working. So I was well protected, and I believe that the patient were well protected too. Yeah.
Yeah. So are people wearing masks like they are in Thailand in the UK?
Well, up to a few weeks ago, I think people did wear masks, when they're outside. But I think the government advice, this is from the British government, the English government, they advise that people should wear masks if they go into kind of closed, public places or public transports. But if they're in their home or kind of outside in their garden or walking into an open space, the advice was not to wear masks. So I think it's pretty different to Thailand. Yeah. As you may have heard that I think the evidence at the time that was proposed by the WHO and also the best scientific advice in the UK, they said that the masks stop the infection from being spread from the infected individual, but it doesn't really stop you from catching the infection. Those simple surgical masks. But if you wear like the FP3 mask, then that is more expensive and certainly was very difficult to find. Healthcare professional, they wore those.
So, I mean, in your medical opinion, how has the UK handled the COVID-19 situation compared to Thailand?
Yeah, well, from the UK, I was here right from January. Prior to that, I was in Thailand on holiday. I think Britain, they have a lot of factors to consider. So it's not just, the COVID-19, but they had to consider about, the traveling between countries, the economy, so I personally felt that, they did shut their country a few weeks kind of too late. I think if
Yeah.
they did close down their borders back in kind of say the end of January or the beginning of February, then I think we would have had less cases and we would have been able to recover sooner. But I understand that the government had several factors to consider, and it was such a difficult situation to be in then, because at the time little was known about this virus, how easily it can be spread. So I wouldn't blame them totally for not closing their borders sooner.
Yeah. So you've been in the news recently speaking about the difficulty about coming back into Thailand. I've got really, really high praise for the Thai government for all they've done so far, all their lockdown efforts. And they've also, for non-Thai speaking people living in Thailand, they've done a really, really good Facebook page called, what is it, PR Thai government. And they come out with daily updates and everything's in English. It's been really, really good over here.
Yeah.
But no one can truly predict the outcome of this. So, you've been in the news recently and you've become a spokesperson for Thais stranded abroad. What steps do Thais have to go through to repatriate?
You mean the remaining people outside the country?
Yeah.
It's very difficult because you have to consider that the resources Thailand has. I mean, to get these people in, they need to ensure that they have sufficient resources to cope with the numbers. But at the same time, we have several, and we're talking about thousands, if not 10,000s of or more, okay, of kind of Thai nationals, okay, that are being kept outside Thailand. Now, the step that the government will need to be taking, they need to create more resources within the country. Okay, I think in order to get these people back in safely, and to avoid the second, the third, or the fourth waves of infection within Thailand, the only way they have to do is to create more resources. So the quarantine, accommodation for the quarantine, will need to be looked at. At the same time, the people that are stranded outside the country, I think I would like the listeners to understand that some of them do not have other nationality. They just have Thai nationality, and if they are out there on a tourist visa, okay, they will not be entitled to any support, okay, whether it's free healthcare, free accommodation, financial support from the UK government. They have to be living here, and they have to be paying everything themselves, including when they get ill or need to be admitted. And it's very expensive. A bed in the NHS hospital would cost something like £800 a night, excluding
Oh, wow.
medical, nursing, and medication fee. So I would hope that the Thai government can come up with a rapid solution in terms of state quarantine, testing, contact tracing, that is even more effective and efficient than what they have right now, which is already good, for the people who live inside the country. But I wouldn't like the people who are stranded outside to be forgotten, because these people are suffering too. And I think they're Thai, they deserve to be treated in the same way as the people inside Thailand.
Yeah. So I've got a lot of friends that are trying to come back into Thailand at the moment as well. Not all Thai nationals, people with long-term visas, work permits, spouses, kids, and it's everybody wants some answers. But yeah, I'm happy with what the Thai government's given in terms of news, but some nice responses about coming back into the country would be amazing as well.
I think we need to ensure that the proposal, the plan that they've been proposing this week, I think that need to be able to put that into action, because I certainly believe that action is louder than words. So whatever you propose, I think is very difficult to put into practice, but we need to try to come up with steps, that allow the objective to be met, which is to bring, the people, the Thai and the non-Thai, because the non-Thai nationals, a lot of them are married to Thai nationals. You can't split up the family. They need to come as a family. So I'm not just speaking, on behalf of the Thais that are stranded outside the country, but also, the rest of the family, who are kind of, British, French, the US, Chinese, Japanese, there's probably lots of people here. So just because, I congratulate them, for controlling the infection, the COVID infection inside the country pretty well. And I think they're probably one of the best country in the world.
Agreed.
But also I think we need to also consider the people that maybe the smaller number of people, but they're still, our people. And we can't really leave them to be, living outside, and, the foreign government, they're not supposed to be responsible for these people, are they? So, I mean, obviously, if you have other type of visa, so you have student visa, a long-term kind of work permit visa, you're entitled to treatment. You're not entitled to, as a student, you're not entitled to financial support or accommodation. But if you are a resident, i.e. a Thai national with an indefinite leave to remain, yes, you're entitled to accommodation, to free treatment, like, British people are. But I'm focusing on the traveling visa, tourist visa. That is where I had a lot of communication from.
So in the UK, I mean, we obviously have an NHS similar to Thailand. In the UK media, they love to say that everybody gets it for free, and people come over to England to get free medical care. So that's not the case for tourists, for people on tourist visa.
That is certainly not true. Okay. I mean, the NHS, as you know, they are doing great work, but they are struggling. Okay. I really admire them though, because, if you're British, if you have indefinite leave to remain, or if you're a student here, you're working here on a work permit, you're entitled, to more or less all the healthcare treatment that British people do have. But Thai national who come on a visiting visa, tourist visa, they are not entitled to free treatment. So if they become unwell, i.e. if they've got a chest infection, and doesn't have to be COVID, if they need antibiotics, they can go and register with a GP practice within their area. They will need to show them their passport and their visa, okay, what type of visa they come in with. They need to make sure that they have the owner of the household they're living in, going with them as well, just to confirm that, these people have got accommodation. And they can register. If the problem is not urgent, they may have to wait for a few days, some for a few weeks. And with regard to mental health problem, that may not, if they're not kind of completely, fully suicidal, i.e. going to kill themselves straight away, that may take, a bit of time for them to see the doctor. So once you get to see the doctor, these are private patients we're talking about now. They'll probably be having to pay between 50 to 100 pounds for a 10-minute consultation.
Wow.
Okay, so that is equivalent to what, 2,000 baht to 4,000 baht. That is just to see the doctor. So if you need medication prescribed, and some of them, they have to pay privately for the medication at the chemist. So you get this green sheet prescription, like British people do, but it would say private prescription. And you take that to the chemist, and it depends on the cost, the true cost of the medication. They have to pay the full price. The English government or the British government will not supplement, any costs for you. So some medication, may be costing you 50 pounds just for 7 tablets. Wow. I know that antibiotics, certainly, I think private prescription costs something like maybe 500 baht. But if you need something more complex, like chronic illnesses or heart problem, lung problems, mental health problem, antipsychotics, antidepressants, that may cost a lot more. Yeah, so And you may have to go back to see them again if you've got something so complex that the GP might want to see you in a week. So you end up having to pay another consultation fee of 50 to 100 pounds, and then some more medication fee. If you need to be admitted to hospital, after 4 hours of being in A&E, and they try to push you into the ward, and then you start paying straight away. And one day is 800 pounds for a bed.
Wow. Wow. Wow.
So it's not as simple, and that's why I had a number of Thai nationals who come here came here back in February, January, and their flight got cancelled in March, and they were supposed to be here for 2 months, and now they've been stuck here. They're running out of money. They running out of medications. They may encounter other health problems, like the one that's been on the news, a lady with mental health problem, and she ran out of medication 2 months ago because she only came here for 2 months. She was supposed to be here for 2 months, and her husband is English, but they're not married. So if you're not married, you're not entitled to anything, in regard to the Thai lady.
Okay, so they're boyfriend and girlfriend, and she came here she went to the UK just on a tourist visa.
And it's her first visit to England. And they've been together for 3 years. Normally the gentleman, he's quite old now, he's about 74, okay?
Wow.
With health problem too, but he's a real gentleman. I've spoken to him. So normally goes out there and spend time with his loved one. But this year is the first year he invited his wife. I mean, their husband and wife. It's just that they haven't signed the marriage certificate.
Yeah.
It's the first time that she's been invited, and she comes, and she was completely fine. And right up to about a month or 2 months ago, when she started to decline because there's no medication, and her husband just couldn't help her to get into a GP, because during COVID it was so hard to see a GP. From a doctor's perspective, I know the system, but these non-medical people, they don't know the system like I do, so they have difficulty of accessing. So that lead me to think that if you're Thai nationals and you're stuck outside the country, you're not entitled to any benefit or support from the foreign government. I think at least they should have some support from the embassy. I think that's why we have an embassy in every foreign country. There was short accommodation, short money. I think they should be able to go there to seek help.
Yeah. So, I mean, I live in Phuket, in the province of Phuket, and obviously it's lovely. Yeah, everybody has their own struggles. And one thing that I would say is that all over Thailand, people are coming together and donating food and essentials. Is the same thing happening in the UK?
In the UK, I mean, if you go to supermarkets, particularly up to a few weeks ago, there would be some trolleys, with donated food, and you can go and get them. But at the same time, the government is advising people to stay inside. Some people may not have even the transport to get to the supermarket, because when you're here, your daily expense is, you can live in Thailand on 100 baht. But you cannot live in England on 100 baht. Okay? Yeah. The meal in Thailand costs, you can buy a cheap meal for 30 baht, but you cannot buy a meal here for 30 baht. Even a bottle of water, if you buy a 2.5 litre or 1.5 litre, that costs something like 30 baht already.
Wow.
So it's really hard for them when they don't have work, and they're being stuck out here because of the COVID-19 policy, in Thailand. It's just so difficult, and I feel for the Thai government too. I think they have lots of work to get on in Thailand. They're looking after 70 million Thais and foreigners as well.
Sure. Well, let's hope the lockdown can end safely soon.
Yes, I hope so. ขอบคุณครับ